Welcome to Tocilizumab Chronicles Beyond the Cytokine Storm, a podcast where we explore the science and impact of this medication in immunology. I'm your host, Dr. Shikha Agrawal, and in today's episode on Beyond the Joints, Tocilizumab's impact on rheumatoid arthritis, we are joined by Prachi Virat, our microbiology maestro with a passion for microbiome and bioinformatics. Welcome to the show, Prachi. Let's decode what's really happening here.
Such a kind introduction. I am thrilled to be part of this discussion on tocilizumab's role in treating rheumatoid arthritis.
Let's dive right in, Prachi. Can you share some insights on tocilizumab's efficacy in treating rheumatoid arthritis?
Yes, definitely. Clinical trials have shown that tocilizumab significantly reduces symptoms of rheumatoid arthritis such as joint pain, swelling. Patients treated with tocilizumab often experience quality of life and reduced disease activity.
That's promising. How does tocilizumab compare to other treatments for rheumatoid arthritis?
Tocilizumab is often used in patients who haven't responded well to other treatments such as methotrexate or TNF inhibitors. Studies have shown that tocilizumab can be effective in these patients, providing an alternative treatment option.
What about safety concerns? Are there any notable side effects associated with tocilizumab?
Yes, there are common side effects including infection, elevated liver enzyme, and change in lipid profile. However, serious side effects are rare, and monitoring patients regularly can help mitigate these risks.
That's reassuring. What can patients expect in terms of outcomes when treated with tocilizumab?
Patients have often experienced rapid improvement in symptoms, with some studies showing significant responses within a few weeks. Long-term treatment can also lead to sustained disease control and improved functional ability.
Speaking of that, what are some key considerations for healthcare providers when prescribing tocilizumab for rheumatoid arthritis?
Great question. Healthcare providers should carefully evaluate patients' suitability, monitor for potential side effects, and adjust treatment as needed. Regular assessment can help optimize treatment outcomes.
Before we wrap up, are there any emerging developments or future directions for tocilizumab in rheumatoid arthritis treatment?
Certainly, the ongoing research is exploring the potential for combining tocilizumab with other treatment or using it in earlier stages of disease. These studies may further define its role in treating rheumatoid arthritis.
Prachi, our audience is going to love the clarity and depth you brought to this topic.
Thank you for having me. It was a pleasure discussing tocilizumab's impact on rheumatoid arthritis.
That's all the time we have for today. Thank you, listeners, for spending your time with us. If you enjoyed today's discussion, be sure to subscribe and let a friend know about the podcast. Until next time, stay curious.